adult. So I am going to turn it over to them. Alexis and Christina?
Good morning. Thank you so much for having us today. We're really looking forward to talking about this important topic today. I'm Alexis Altop, and as Kathy said, I'm the policy manager at Healthier Colorado. And just to contextualize how I got involved in youth mental health advocacy, when I was a teenager, I was experiencing really chronic suicidality, and it wasn't really addressed until it reached a crisis point. And it sounds like counterintuitive, but it ended up being one of the best things that's happened to me because when I got to go to treatment, I learned coping skills and it really set the trajectory of my life on a different path. Because prior to that, I was like failing school. I didn't really have a vision for what I wanted to do in adulthood, and being able to get connected with treatment really changed my life for the better. So I appreciate the opportunity to talk about this topic with you today, and I'll pass it to Christina.
Thank you, Alexis, and thanks so much for having us. My name is Christina Walker. I'm the Senior Director of Policy at Healthier Colorado. I've been a advocate at both the federal and the state level for many years now, with a focus on perinatal and young child health, and early childhood education and supports. So you'll hear a little bit about that today. But I've also experienced my own mental health challenges over the years as a youth and young adult and into adulthood. And so just really appreciate the ability to talk about this really important topic and appreciate all the work you all do at the local level or at the state level to support the youth in Colorado.
I'm going to go ahead and get our slides up. Um, are you able to see? No.
Oh no, we see your calendar.
Whoops. One sec. One moment. Let's see.
This is always my most stressful part of being on a Zoom is sharing my screen.
All right. One sec. Sorry. All right. Are you able to see it now?
Yeah, thank you. Good job.
Thank you. So today we're going to be talking about youth mental health in Colorado, really looking at the data that of where we came from pre-pandemic to pandemic to now, and how that informs our policy decisions and our pathways forward. We're going to look at an overview of youth well-being in Colorado, exploring both early childhood, adolescent, and teen mental health. And then we'll do a few deep dives by age. So Christina will be talking about infant and early childhood mental health, and I'll talk about teen mental health and some of the stressors we heard. Then we're also going to just talk about the policies that are currently shaping Colorado's behavioral health system and some possible pathways forward. And then at the end, we'll conclude with some time for question and answers. Please feel free to submit questions into the chat, and if they're easy to answer while we're on a slide, we'd be happy to do so, or we'll answer at the end during the Q&A.
Awesome. Well, for those of you who may not know, Healthier Colorado is a nonpartisan nonprofit, and we work to improve laws so that everybody in our state has a chance to live a healthier life. And we really work across physical, mental, or behavioral health and the social determinants of health. We focus statewide, but we also do local work, either through local ballot measures or local supports for county commissioners and city councilors. We definitely take an equity and inclusivity lens to engaging in policy and making sure that we either reaching a population deeply or our public health approach to a policy is reaching the far expanse of our population in Colorado. We help to support people to educate and advocate, and we want to really drive action and systemic change with our work. And so that's one reason why we are here today, to try to help support you all in doing your work. Go to the next slide. Great. So we wanted to ground ourselves in really a public health approach to mental health and how we get from, you know, ensuring that we have the best environment to support mental health and behavioral health in Colorado, all the way down to supporting somebody who needs help. So one thing we talk about a lot is prevention and promotion. And so you'll hear a little bit about that as we even go through each individual kind of time period, because prevention and promotion can look different at different ages. But overall, what we think about in this public health approach is that we are setting up our systems, our communities, our families to be successful. So first and foremost, ensuring that the social determinants of health are met for individuals is key to ensuring that they will not have both physical or mental health challenges. So making sure that people have access to food, people have access to work, childcare, they make a living wage, people have access to go to a doctor and have health insurance. All of those things impact somebody's overall ability to secure and keep their mental health over time. And so we want to make sure our communities are set up that way. Also, there's a lot of work that our state has done around prevention and promotion in terms of education, right? Like first and foremost, educating the public that everyone has mental health and trying to decrease the stigma so that people are willing to talk about it, to seek help. And also being able to notice when somebody might be struggling and how we can intervene early. Sometimes if you can catch a crisis on early onset, you can mitigate longer term or more serious symptoms and repercussions for later. But that's not always the case. And for folks who really need to go into treatment, which could be because they have a behavioral health issue such as substance use, suicidality, eating disorders, or maybe they are getting diagnosed potentially with a mental illness such as schizoaffective disorder or bipolar disorder. All of those things will likely lead somebody into treatment at some level. And so that can be anything from outpatient to intensive outpatient programs to partial hospitalization programs, or other inpatient or residential treatment programs. And I think one of the most important things, oh, could you go back? Sorry. One of the most important things to talk about when we also talk about a public health approach to mental health is recovery. Oftentimes, because recovery services are not covered by insurance, one of the biggest long-term things we can do to help people keep and maintain their mental health is invest in recovery services. And also, again, I think those social determinants of health are really important in ensuring that somebody can stay in recovery. So I think that this continuum is really important to think about as we think about how we're setting up our systems and our services throughout Colorado communities. Okay, now we can go to the next slide. So as I mentioned, I have a background in perinatal, maternal, and early childhood health and wellness. And a lot of people don't know this, but babies have mental health too. We all have mental health. And mental health really starts forming, and the basis of brain development starts forming during the perinatal time period. And it is very important to ensure that families have everything they need during this time period where a baby's brain is basically being formed. By the age of 5, 90% of a person's brain will develop. So it's really important that we are ensuring that they are not experiencing trauma, that they have protective factors, and really most important, it's that strong caregiver relationship, often the parent, but it can also look like a teacher at a school, like if they're in childcare. It can also be a grandma or a kinship provider or a foster parent. It's important to know that between 10 and 16% of young children ages 2 to 8 years old have a diagnosed mental, behavioral, or developmental disorder. Early investments in mental health treatment will allow children to be able to improve and get the services that they need in order to catch up on their healthy development, and also to, in the long term, prevent potential other mental health crises for the future. And so it's just really important to invest early. A lot of people right now are focused on like the youth mental health crisis, but we were all babies once, and so many things about our young and early childhood can impact what happens in our adolescence and young adulthood as well. Next slide. So, in this time period, there are interventions that we can do to support parents. So, first, and making sure that their child's mental health is sound. And when you think about this time period and mental health, we're not talking about like diagnosing young children with mental illness like schizoaffective disorder or even depression. However, usually what it shows up as is a developmental delay in some way or a behavioral concern. So what the best things that we can do is to support the child's caregiver in making sure that they're setting up healthy environments. They themselves have their own mental health supports, as well as that they are having appropriate attachment and trauma-informed care for their young child. There are a lot of two-generation interventions and strategies that we can use in this time period. When you intervene at this time period, you're not talking about a young child going to talk therapy for obvious reasons. Young children can, especially once they get a little older, like 3, 4, and 5, can be it can be worthwhile to do some talk therapy, but for the most part, these young children don't have language in the same way or an understanding of what is happening to them in the same way that you and I do, who are adults. And so, really, what it is important to do is intervene in a developmentally appropriate way. And so, there are integrated behavioral health care models into where they integrate a behavioral health care or a child development specialist within a primary care setting. So there's a program called Healthy Steps that we have here in Colorado, where a Healthy Steps child development specialist will be integrated within a pediatric setting to really support parents and young children in that 0 to 3 time period. We also have direct interventions like child parent psychotherapy or Child First, which is a home visiting model that does direct child and parent dyadic treatment. And so when you're thinking about this time period, it's really important for both the young child and the parent or whoever's the main caregiver to be involved in the treatment at the same time. There are also different ways that we can invest in that prevention and promotion through parenting classes. Parenting classes such as the Motherwise program that we have here in Denver can teach new moms and pregnant people about what a healthy relationship looks like. And those healthy relationship skills can not only help them maintain a healthy relationship with their partner, or with other family members that can be a support to them, or with even their employer to be able to maintain employment. But it also can help build the infrastructure that they need to support their child when the child's born. So there's a lot of ways that we can intervene all the way from a prevention standpoint, all the way to supporting a family and getting the social determinants of health met, and all the way into actually having dyadic psychotherapy treatment. Next slide. We've made a lot of policy developments here in Colorado over the last 30 years, and happy to point you in direction of additional resources, but a few opportunities that have happened in the last few years that I wanted to highlight are programs like Cover All Coloradans that is giving access to health insurance through our Medicaid and CHIP program for pregnant people, postpartum people, as well as young children and children of all ages, regardless of their immigration status. I think it's not surprising that having healthcare access and ability to afford healthcare is the first and foremost important thing, especially for young children. There's 12 well child visits that are required for a young child in the 0 to 3 time period. And so without health insurance, a lot of those developmental milestones, if a child's not reaching them, might be missed. And so again, health insurance access is so important. We've also done our health insurance, our Medicaid agency has done payment reform to better support the integration of primary care and behavioral health care. There are ways that our uh, billing code and payment structures have been set up in the past to make it challenging to run an integrated model. And so having the ability to make those payment reforms has made it much more easy for a clinic to integrate behavioral health care into their clinic. And you even see this now, not only in pediatric settings or primary care settings, but even in OBGYN or midwifery practices, because again, there's a lot that happens during that perinatal time period. And then last, I wanted to share that in 2023, our state passed Senate Bill 174, which provided access to behavioral health services without a formal diagnosis for kids 21 and under. And why that's really important because it allows providers to not have to diagnose a child, which is often inappropriate, especially younger children when they don't even have language yet. It's inappropriate to put a clinical diagnosis on them in order for them to get treatment. The person will need a lot of time to work with these children to actually determine what might be happening and what is the cause of a developmental delay. And so being able to access treatment without a formal diagnosis decreases that barrier. And it's important to note that it allows folks to intervene based on like maybe they've experienced a childhood trauma, like losing a parent because the parent died or they were separated due to being deported or even incarcerated. So you can intervene with that child and that other parent or other caregiver in the moment, so that way you can mitigate the longer term effects. And I will say that this is really, really important for those young children because a young child is not going to tell you in the same way that an adult would what happened or what's going on, but it will show up eventually in their behaviors and in their development. Next slide. Go ahead. I'll pass it over to Alexis. Oh, you're on mute, Alexis.
Now to transition to children and adolescent mental health, we also wanted to look at the importance of early intervention. So about 2 in 5 Colorado kids ages 6 to 17, about 38%, have a mental health need. And the vast majority, about 80%, have mild to moderate symptoms, and most, about 65%, could be treated appropriately in evidence-based primary care models, like integrated care, as Christina mentioned. A much smaller group of children require more complex care, and fewer than 1 in 50 need intensive or crisis services. In addition, it's really important to have early intervention in this age group because half of all mental health conditions appear by age 14 and 75% emerge by age 24, meaning that the earlier we identify and address the mental health needs of children and youth, the better their outcomes are over their lifespan, not just for their mental health, but for their education, employment, and lifelong well-being. When thinking about the mental health of children and adolescents through a public health framework, the data from the previous slide is pretty promising because it shows that we can reach the vast majority of kids through early intervention and treatment before mental health conditions escalate into being a crisis. One thing to think about with adolescents and teens, though, is that they face unique barriers to treatment or early intervention in the fact that like they don't have independence of transportation and they're relying on their parents' insurance. And sometimes they don't even have the social emotional skills to identify that they are feeling these feelings that could be treated through early intervention before they become a crisis. So sometimes things end up bubbling over and becoming a crisis just because of the unique challenges that face children and teens. So looking at the landscape of youth well-being, on the whole, across the United States, the rates of depression and anxiety among youth have climbed pretty steeply over the past decade. And this is especially true for girls, LGBTQ plus youth, and youth of color. The decline in young people's mental health was really accelerated during the pandemic, but the trends we saw were just exacerbations of already declining mental health trends in our state and the United States as a whole. Then in 2021, Children's Hospital of Colorado declared a state of emergency for youth mental health, which really helped to bring this conversation to the forefront of the public policy agenda for healthier Colorado and the state of Colorado as large. At this time, the state also received an influx of ARPA funding, which really helped to fund a lot of the interventions that we're going to talk about later in these slides. The declaration by Children's Hospital was made in the midst of a surge in ER visits for mental health crisis by youth, and they saw visits for mental health crisis increase by 140% between 2016 and 2021, compared to only a 23% increase for adults. And at this time, suicide was also the leading cause of death for children between the ages of 10 and 18, and it was the second leading cause of death for young adults between the ages of 20 and 24. While most kids are still able to be treated with early intervention, Children's Hospital Colorado reported that they're still seeing more kids in crisis, and the increase in demand for their youth mental health services was the largest share of growth of demand compared to the other populations served within the hospital's health system. Looking at where Colorado falls in terms of the well-being of our children and teens compared to the rest of the United States, here in Colorado, nearly 22% of teens aged 12 to 17 experienced a major depressive episode in 2024. This ranked Colorado 48th in the United States for prevalence of major depressive disorder among youth, according to the 2025 Mental Health America State of Mental Health Report. This really means that about 1 in 5 Colorado youth, amounting to 96,000 teens, experienced at least one major depressive episode last year, which was well above the national average. Colorado also ranks 46th in the nation for youth substance use disorders, with nearly 10% of teens that were surveyed reporting recent substance use. Colorado's youth rankings for Mental Health America have really been all over the map the past few years. It was 13th in 2022, improving to 21st in 2023, and then it dropped back to 44th in 2024. And now in 2025, we're sitting at 31st. These changes really highlight how volatile our youth mental health outcomes are and how much they depend on access to care, prevention, and system-level supports. One bright side is that Colorado ranks 6th in the nation for youth with depression who did receive mental health services, meaning more of our young people are getting the help that they need, which in kind of like a dark topic of youth mental health, this is a huge accomplishment. We also saw that only 22% of youth in Colorado skipped a preventative healthcare visit last year, which is significantly better than the national average of 28.6%. This suggests strong connections to primary care where mental health screenings and early interventions can happen. We've also seen that fewer youth in Colorado have private insurance plans that exclude mental health coverage, at about 7% compared to the national average of about 9%. That's encouraging progress on parity and coverage. Well, with major depressive disorder being one of Colorado's lower ranking areas, the percentage of teens between the ages of 12 and 18 who experience a major depressive episode rose from about 7% in 2011 to about 15% in 2019. This increase was happening leading up to the pandemic, and it was especially pronounced for the 12 to 17 age group between 2013 and 2019. Suicide is still one of the hardest topics to talk about when we're discussing youth mental health, but it's definitely an important area that Colorado needs to continue focusing our efforts. Unfortunately, Colorado's teen suicide rate has exceeded the national average since at least 2012. And sadly, between 2010 and 2021, Colorado's youth suicide rate almost doubled. The rate of suicide among Colorado's teens boys was particularly elevated. And LGBTQ plus teens and teens of color in Colorado also experience increased risk for suicide and suicide attempts, both here in Colorado and the United States as a whole. Just over 13% of youth aged 12 to 17 in Colorado expressed serious thoughts of suicide in the past year, while the national average was about the same, according to the Mental Health America rankings for 2025. which is positive, but this still amounts to about 59,000 teens in Colorado experiencing suicidal ideations last year alone. While not all of these children experiencing suicidal ideations go on to make an attempt or to die by suicide, it is still an extremely concerning statistic. The positive side is that the Healthy Kids Survey report from last year reported that the 2024 rate of suicidal ideation dropped to 5.8% or 5.8 per 100,000, which is the lowest rate in Colorado since 2007, which is also a huge deal. It shows that prevention is working when it's consistent and coordinated. And we'll go into some of the policies later in this presentation, but it also goes to show that recent investments that have been made here in Colorado are beginning to yield tangible results. In Colorado, geography plays a major role in mental health access, and gaps in access in rural regions of our state are still an area of concern. For example, the youth suicide rate is about 35% higher in rural counties here in Colorado compared to urban areas, at about 19.8 per 100,000 versus 14.7 in urban areas. The percentage of high school students that reported serious suicidal ideations was also elevated in rural areas. High school students also reported that they would be less likely to seek support if they were experiencing mental health concerns. This is not necessarily about their desire to seek help. In many rural counties, there are no child psychiatrists or very, very few. This means that telehealth has become a critical avenue for Colorado children and teens to access mental health supports, especially in rural regions. And while there's been expansion through telehealth for families without broadband or reliable transportation to in-person appointments, the barriers to seeking critical treatments can still be too much to overcome. The Healthy Kids Survey showed that suicide attempt rates doubled in Southwest Colorado, which on this map is Health Statistic Region 9, and it climbed to 10% in Region 17, which encompasses Clear Creek, Gilpin, Park, and Teller counties. In many of these communities, as I mentioned, there are no child psychiatrists and sometimes no school psychologists. That's why programs like telehealth expansion and school-based clinics have become so critical. And that elevated rate, the 10%, is compared to the statewide average of about 4.3% of students statewide that attempted suicide last year. It's also important to know that females and LGBTQ+ teens exhibited a significantly higher likelihood of contemplating, planning, and attempting suicide here in Colorado. When discussing teen mental health, we wanted to really center the voices of young people directly, because none of the data points we just went over really capture what it's like to grow up in this moment the way that teens can describe it themselves. So in the fall of 2023, Healthier Colorado conducted a statewide listening tour where we spoke to teens, high school students, about their mental health. And the most major stressors we heard were about academic pressure. Teens described a constant need to excel, to get good grades, take advanced classes, and get into the right college. And many of them said that they were tying their self-worth to their performance academically. That kind of perfectionism and fear of failure was really intensified by constant comparison to their peers at school, to their siblings, and even to the curated lives they were seeing on social media. We also heard from them about their family dynamics. Some young people said that their parents want to support them, but don't necessarily fully understand the pressures that they're facing today. And others described the feeling like their parents didn't realize how bad their mental health had gotten until they were in a crisis or after crisis. Teens also spoke about their friends being their front line of support for themselves, that they were more likely to go talk to their friends about their mental health struggles than they were necessarily their parents, although some did find a source of support in their parents. Many others talked about other trusted adults in their lives, coaches, teachers, mentors, as very important parts of their support system. And this was especially important for kids who said that they had to go outside of their home to find support. Teens also often were talking about their bigger environmental stressors. climate change, the threat of violence in schools, and the political climate, and how that all adds to a sense of anxiety and uncertainty about what their future holds. Finally, almost every teen we talked to mentioned that they couldn't access the help they need until they reached a crisis point. School counselors, they described, were caring but overloaded and only available when things got really bad. In addition, a theme we saw throughout all of our conversations with kids was the impact of technology and social media on their mental health. This really added to the feeling of FOMO, the fear of missing out, when they would see people online able to get into their dream college when they had just gotten rejected, seeing their friends hang out when they were unable to go, and in general, feeling like they were experiencing more and more interactions online than they were in person. And we'll get into that in a moment. So I really wanted to also just share some of the quotes from the teens we talked to so you all can fully hear from them what it's like to be a teen right now. So one of them said, if I feel not trying, that's easier than saying I failed while trying, because then it just confirms that I'm not really good enough. When talking about social media, one said, when I was struggling with insecurities and my self-worth, social media just made it worse. For trusted adults, it said, if you don't have support in your family, you have to go somewhere else to find it. And then access to early intervention. A lot of times parents and teachers just want to support you, and it's sad that it sometimes takes a kid getting to the edge of where they are suicidal for them to see that there needs to be a change. These kids really are advocates for themselves, and it's important to include them in conversations because they know more than anyone what their needs are. And in our experience at Healthier Colorado, they also had a very good sense of what they thought needed to be improved. So academic stress was one of the main things that we heard from these teens. And to be honest, a lot of them were high achievers at their schools because they were part of programs where they were able to get connected with us at Healthier Colorado. They were part of youth groups that really built leadership skills. So this doesn't necessarily capture the full breadth of what kids across all spectrums might be saying is their biggest issue. But one of the things that we've heard really helps kids that are dealing with academic stressors is school-based mental health services. And Colorado has made significant strides in offering more social and emotional supports in classrooms. But unfortunately, there's a troubling shortage of mental health providers in schools. The American School Counselor Association recommends that school districts have a student-to-counselor ratio of about 250 to 1. And in Colorado, during the 2023-2024 school year, 84 districts had a higher ratio of counselor schools than that recommended ratio. And then among the 144 districts that did have a school counselor, the average ratio was 316 to 1. In addition, the Behavioral Health Administration, BHA, reported that during the 23-24 school year, nearly 2% of counselor positions remained unfilled. Compared to prior to the pandemic, this percentage was less than 1% of positions that were remaining unfilled. This shortage is really heightened in rural districts for state. For example, 113 of Colorado's 178 school districts had no licensed school psychologists employed by the district. And a similar number of districts had no school counselors. And 35 districts had no school counselor at all. And then within Colorado counties, 46 of Colorado's 64 counties had no practicing child or adolescent psychiatrist, which really points to a workforce shortage across the state. So across the state, demand for mental health care has skyrocketed, and our workforce simply has not kept up. The number of openings for behavioral health positions grew by 152% between 2019 and 2022, and projections from the BHA show that there's another 30% increase in these shortages anticipated by 2030. This means that even as more people are willing to seek help, they may not be providers available, especially in rural areas of our state, which you can see here on the map. Those are areas where there is a mental health workforce shortage. In fact, this August, the Behavioral Health Administration estimated that Colorado will be short more than 4,400 mental health professionals by just next year, 2026. Now, it's important to recognize that Colorado ranks 10th in the nation for mental health workforce availability, which is a positive. And we have about one provider for every 220 residents in our state compared to the national average of 320 to 1. So this issue isn't necessarily that we're doing worse than other states in workforce, it's that the need for mental health supports has grown much faster than our progress can even keep up with. And this shortage of the mental health workforce is showing up everywhere. In community mental health centers, in schools, in primary care clinics, and in crisis response. When we're thinking about policy solutions, in any policy we design, we really need to think about if we have the workforce needed to deliver it, because we can have blue sky dreams for like what we want our mental health system to look like. But if we don't have the workforce needed to deliver on our investments, then they will continue to fall short. So another deep dive we wanted to go into was social media and youth mental health. Social media is now a part of daily life for almost all teens, and social media algorithms are built to maximize user engagement by default, which children and teens are particularly susceptible to. In 2022, the former US Surgeon General released a youth mental health advisory, which recognized social media's effect on youth mental health as a significant public health challenge. Just to offer a few statistics to conceptualize this issue, up to 95% of youth between the ages of 13 and 17 report using social media. And more than a third report using social media nearly constantly. A study of US adolescents between the ages of 12 and 15 reported that youth who spend more than 3 hours a day on social media had double the risk of increasing poor mental health. And this included symptoms of depression and anxiety. But in 2021, 8th graders reported spending an average of 3.5 hours a day on these sites, with 20% spending 5 or more hours on the platforms and 1 in 7 spending over 7 hours a day on social media. Despite most social media sites having age restriction of being 13 to use a site, 40% of 8 to 12-year-olds report using social media. So kids are getting on even though you have to affirm that you're 13 to use them. And here in Colorado, the Healthy Kids Colorado survey found that among students who use social media, over a third report it makes them feel sometimes or usually worse. This percent is much higher in females compared to males, and with bisexual students compared to straight students. Some potential harms that have been identified in the Surgeon General's report include social media negatively affecting body image, especially for girls between the ages of 13 and 17, worsening sleep quality, and opportunities for exposure to predatory and hate-based content. I think it's probably very related to what a lot of the sexual assault advocates in this group work on, but unfortunately, bad actors are skilled at identifying youth experiencing hardship and finding them online and leveraging that to take advantage of them. In fact, a majority of girls aged 11 to 15 reported unwanted contact by strangers online that made them feel uncomfortable. When thinking about this issue, it's also helpful to recognize the positives that come from social media. It helps youth form positive connections to other people in online communities who have similar identities and interests, which is especially important for youth of color in Colorado and LGBTQ+ youth, which we know are age groups that have worsening mental health compared to the rest of the state. So it's important to approach this issue in a way that balances the need to create healthy online environments with allowing youth to feel connected with their peers. Another emerging risk is AI chatbots. Artificial intelligence and generative chatbots are a part of daily life for many families now, including children and teens. And with the emergence of this new technology, there have been new online risks that have been impacting the well-being of youth and children in Colorado. A recent survey found that 72% of teens have used an AI companion. And children and teens are increasingly turning to chatbots for support on schoolwork, but they're also turning to them as a source of entertainment, companionship, and advice, which is particularly worrying when they start seeking out psychiatric or therapeutic advice from a chatbot. instead of a mental health professional. AI chatbots that are anthropomorphic, meaning that they're designed to interact with users in a way that feels as close to human interaction as possible with their tone and their conversation, are not necessarily designed with kids in mind, which means that they can be more risky for young users. And we know that adolescents are particularly vulnerable to these risks because their brains are still developing, and they're in a period of identity exploration and boundary testing. We've heard from children that they're able to form parasocial relationships with AI chatbots, and they become very connected to their AI avatars or virtual companions. And unlike humans, chatbots don't have a sense of duty to protect kids. They're informed by the inputs they've received from other users, so they sometimes provide responses that are false, threatening, violent, or even overtly sexual to kids. A particularly worrisome example of an AI social companion that's capturing the interest of children has been character AI, which allows users to chat with an AI character that are based on celebrities, fictional characters, or entirely unique characters that other users are creating. I won't go into too much detail because I don't know this family personally, but the Social Media Victim Law Center here filed cases on behalf of 2 Colorado children who died by suicide or were sexually abused through interactions with character AI. In the case of one of the Colorado children that was just 13 when they died by suicide, their virtual companion from character AI, which was named Hero, began responding with sexually explicit replies, and it fostered a relationship with the child that ended up isolating her from her friends and family. She would tell it that she was struggling mentally, and it's like, it's okay, you can confide in me, don't tell anyone else. And so when this young girl shared about suicidal ideations with this character, Hero, the chat box didn't encourage her to reach out to outside sources. And that's just one example that we've heard about. This is actually happening across the nation. So a solution in terms of policy would be to put safeguards in place on what chatbots are able to do in terms of therapeutic advice. And we really need a partnership between parents, providers, policymakers, and children and team themselves to determine what policy safeguards should be put in place on AI to protect children. But until those protections are in place, it's important to have trusted adults support children and teens to have safe and developmentally appropriate interactions with AI technology and chatbots. So I also want to highlight that since the pandemic, Colorado's behavioral health system has undergone a transformation, and we've made significant investments that have helped bolster the mental health of children and youth here in Colorado. There have been a ton of investments made, but a few I want to point out to you all today are House Bill 22-1376, which was supportive learning environments for K-12 students, and it required Colorado schools to strengthen discipline policies to promote restorative practices and create safer, more supportive learning environments for students. And given the prevalence of academic pressure and how many kids are receiving help online, is really important to have schools be a safe place for kids to have mental health supports, although that should obviously not be the primary place that they get it. This bill encouraged trauma-informed approaches rather than punitive discipline and calls for data transparency around suspensions and expulsion. This bill is an important part of prevention because it helps prevent the escalation of behavioral challenges before they become a crisis and helps create positive relationships for students in their school. Another bill was Senate Bill 2304, which helped to address the workforce shortage in schools by allowing schools to directly employ or contract with Department of Regulatory Agent licensed clinicians, which included social workers, counselors, and marriage and family therapists. And this really helped to expand the pool of qualified providers available to students and available to fill that shortage of counselors in schools. For early intervention, House Bill 23-103, voluntary school mental health assessments, was an important stride forward. It allowed students to participate in voluntary mental health screenings through the schools, and then helps connect those kids that screened positive for anxiety and depression or trauma to local care professionals and resources. So these screenings were really helpful in identifying the needs before they reach a crisis point and connecting students who may be in need of care to services faster. One of the biggest strides forward Colorado has taken was through Senate Bill 2401, which made the I Matter program permanent. So Colorado's I Matter program provides youth free therapy up to 6 sessions, and this permanent funding made it a permanent state service. So the 6 sessions are virtual or in person, and they're for anyone ages 18 or under, and there's no insurance required. So as I said, this is one of the biggest steps forward that Colorado has taken to ensure that youth can access timely, confidential therapy, regardless of their income or where they're located in the state, which really reduces barriers to care and helps normalize mental health support, even for those that haven't reached the crisis level that it requires for many students or youth to access care right now. Another major step forward in system transformation has been the creation of the Behavioral Health Administration, or BHA. So since the state of emergency was declared in 2021, the Behavioral Health Administration has been set up, although the process to set it up began back in 2019. And the BHA consolidated more than 100 state mental health and substance use programs under one coordinated agency. And it's now responsible for system-wide planning, funding, and oversight of Colorado's behavioral health ecosystem. The goal of the BHA is to bring alignment and accountability to what was previously a pretty fragmented mental health system, and to ensure that people in Colorado can access those resources efficiently. So now the BHA is responsible for coordinating youth programs across 14 state agencies, and the BHA serves nearly 34,000 kids as of 2023. Another system investment that's been made is the Colorado System of Care, which was launched by the BHA, and it coordinates state agencies and community partners that deliver integrated mental health services for youth with complex needs. And this really spans across education, child welfare, juvenile justice, and healthcare. The BHA is also leading multiple initiatives to grow the behavioral health workforce, and their investments have included loan repayment programs, micro-credentialing for youth-focused models, and a grow your own rural workforce strategy with the Colorado Department of Higher Education. We also want to acknowledge that we've made significant investments and progress in suicide prevention and crisis response in recent years. Nationally, we now have the 988 Suicide and Crisis Lifeline, which provides an easy to remember 3-digit number for anyone in crisis, including youth. In 2024, the former U.S. Surgeon General also released a national strategy for suicide prevention, which provided coordinated public health framework for addressing suicide. Colorado has also been a leader in suicide prevention innovation. Our state has created the Office of Suicide Prevention, which houses the Colorado Follow-Up Project, which supports individuals discharged from emergency departments following a mental health crisis. The state has also invested in the Zero Suicide Colorado framework, which embeds suicide prevention into health systems. And these initiatives and investments have undoubtedly already saved countless lives. A unique feature of examining suicide as a public health issue is the large gap between the number of lives lost to suicide and the much larger number of people that report suicidal ideations. So when looking at youth mental health, and it's important to understand this gap, understanding why some youth stay within suicidal ideation and others go to attempts. Unfortunately, suicide risk, and suicidality are incredibly complex, and it's sometimes difficult to predict for whom ideation will escalate to action. With all of that said, the data does show some encouraging trends. Between 2021 and 2023, the percentage of Colorado kids who considered suicide dropped 6 points, and suicide attempts fell from 7.2 to 5.1%. The Healthy Kids survey also found that youth suicide rate was the lowest it was since 2007. And while previous to the pandemic and amid the pandemic, many kids were reporting that they didn't have access to a trusted adult. More than, I forgot the statistic. Many more now are, one of the biggest bright sides is that many more kids are reporting that they have a trusted adult. More than that, 57% of students say that their mental health is manageable most days now, which is up from 53% just 2 years ago. These are all signs that these policy and community efforts are making a difference. And Colorado youth are showing real resilience, and we're seeing impact from prevention and policy investments, but we still have work to do, especially to close the gaps in rural areas and for kids with fewer resources. So looking ahead, and I'll ask Christina to add in if I miss anything in terms of what we should look ahead to for policy. But we need to continue to invest in prevention and early intervention. Right now, a lot of integrated care is co-located. So that means that the primary care provider and the mental health clinician are just sharing an office space. And one thing we're looking towards is like true integration. So having that mental health provider actually come into the room. So the person at the appointment doesn't have to make multiple appointments and go back to the waiting room just to like access their mental health provider. We need to continue investing in evidence-based programs in schools and communities. And part of this, when we're looking at suicide, really comes to reducing access to lethal means, which we know is part of the reason that rural suicide rates are higher. And part of the reason that suicide rates for boys is higher than females. It just comes down to means. So safe storage of firearms and reducing access to firearms and more lethal means is really important to helping us reduce our youth suicide rate. We also need to continue to strengthen our mental health workforce, especially in rural areas. This could be through telehealth, although there is a sense of telehealth fatigue in many rural communities. But really just making it easier for people to enter the workforce and also to have lower level, like mid-tier providers that are able to, like psychiatric nurses that are able to really uphold the mental health system. We also need to continue sustaining and scaling programs that work. This is especially important in the context of limited state and national funding. We need to make our systems work more efficiently and not necessarily add on even more. And one thing we need to keep in mind while looking forward to policy solutions is to continue centering youth and their families' voices in the policy development, especially youth, because youth really are able, from what we've seen, able to contribute really meaningful suggestions for what policy outcomes will actually matter most in their lives. I'll pass to Christina to add on anything else for looking forward.
I think the only other thing I'd add is that as we talked about and started off with, and we didn't linger there because oftentimes folks are dealing with older children, but I think investing early is really important, and keeping up the investments in prevention and promotion will be really important to really mitigating the longer term impacts and seeing future children from having negative mental health issues. So that's the only thing I'd add.
And finally, I want to feature one thing that Healthier Colorado has been working on, which is acute suicidality. So we've seen this particularly as an issue with young people, that the time between when they first experience suicidal ideation to when they take action can be as short as 5 to 10 minutes. So usually when we think about suicidality, we're thinking of it as like the end of a long decline of mental well-being before someone takes action. But especially with kids, this isn't necessarily the case. And so if we make it so like the only way to get into like crisis services is to have a mental health diagnosis or to like experience mental health symptoms for a prolonged period of time, we're missing a lot of kids that we really could be capturing. And I'll pass it to Christina to talk about how Healthier Colorado got involved in this work and what we've been learning.
Thanks, Alexis. So the picture on this slide is a young man named Matty Linnell. He was from Boulder, and he died in May of 2021 by suicide after a short 6-day quick onset of some sort of mental health crisis. Before that, he had not had any previous mental health challenges. He was an engineer at SpaceX. He was 26 years old at the time of his death, and he was at the kind of the tail end of what we usually see in youth and young adulthood. Although more and more studies suggest that youth and young adulthood crisis onset might go all the way up to the age of 30 and not ending at 26, which is what we previously had thought. So I think there's a couple things that we want to talk about in terms of this work here. So um, I have a personal connection with Maddie's mom, Jordana Ash, from her work in mental health and early childhood over the years. And when she lost her son, and her family lost their loved one, she and I reconnected and we talked about there's this new understanding or newer understanding of how acute the onset of suicidality can be. And a lot of folks that Jordana was connecting with in the mental health fields did not really know about this phenomenon. As Alexis talked about, oftentimes, particularly when we think about like public health and when we think about what the public understands of suicidality, is usually that somebody has been a long sufferer of a mental illness or a mental health challenge, or has been dealing with a lot of other mental health or behavioral health issues, and that culminated in someone's death by suicide. But as we dug into the research, Alexis and I, we realized that that is not always the case. And in fact, there are two potential diagnoses that have been suggested by two leading researchers, one who is a psychiatrist named Dr. Igor Galenker, another one who is a psychologist named Dr. Thomas Joyner, who independently came to very similar conclusions and have suggested potential diagnoses to be entered into the next iteration of the DSM. And just to be clear, healthier, we're not clinicians, so we're not like necessarily saying these are the diagnoses that we need to have. But we do recognize that there is a need for diagnoses often for people to get treatment and for the workforce to be properly trained on these types of issues or new and emerging understandings of mental health challenges, because that's why there are new iterations of the DSM, because we do change and learn and grow over time in terms of how we are thinking about mental health diagnoses. And so in last year, in 2024, we hosted a convening with many of the top experts from Colorado as well as from across the country to delve into this topic of acute suicidality. And we wrote a paper resulting from that convening, which you can access at this QR code. But I think the main takeaway we wanted to highlight for you all today is that there are a lot of things that we can do to make sure we are intervening early and quickly when it seems like somebody, particularly youth and young adults, where this comes from, and thinking through brain development. Our brain does not finish developing our prefrontal cortex until we are about late 20s. And so these young adults are still in the second wave of the most brain development we have in our lives outside of early childhood. And the prefrontal cortex deals with the ability to regulate emotions and the ability to regulate behavior. And so I think when you also think about this time period, folks are maybe going to college, going to the workforce, moving out of their parents' homes, establishing themselves as an adult, or making a huge life transition, and they may not be as connected to their family, loved ones, or others that can help intervene at that time. And so it's also really important we put in place the community services to be able to intervene and have somebody be able to find support if they need it, especially if somebody has moved away from their family. But I'll just say in the case of Maddie, who was living a far from his family. His parents got on a plane and went to him, and he still, and they were with him the night before he passed away. And so I think it's important what one of the leading researchers in this space has shared with us is that protective factors are really important. But once somebody reaches the decision to die by suicide, those protective factors are no longer helpful. And so, really being able to intervene as immediately as possible in these situations and regulate that person's sleep, regulate that person's emotional response is vitally important. So, in our paper, we talk about some of the things that we can do to make our communities more ready to intervene in these situations, such as making sure that schools, hospitals, higher education institutions, employers, and even just each of us as humans through mental health first aid training to recognize like, oh, that's interesting that they said that they're all of a sudden having trouble sleeping, or that they're all of a sudden, um, you know, just taking themselves out of things that they used to enjoy, those kinds of observations. Um, we also need to make sure that people understand about this phenomenon of acute suicidality and that we change the stigma around suicidality and change the understanding that this is like the result of a long-term crisis, mental health crisis. I think without those changes, we'll continue to respond in the same way, and we might always be missing these folks who fall through the cracks. And at the end of the day, we don't know yet what will happen with these potential diagnoses, but I do think it's important to recognize that suicidality can have this more acute onset, and that there are ways that we might need to change our processes, our screening tools, our assessment tools, the way we intervene with folks to make sure that we're catching these folks. And of course, all of our work is really important. The work you all are doing every day to destigmatize mental health challenges, I think is like first and foremost what we need to continue to do. Talking about these things are really challenging, and we're talking about human lives and the loss of human life, but it's really important to talk about so that we destigmatize it at the end of the day. All right. Thanks, Alexis.
So that concludes like the bulk of our presentation, but we would be happy to answer any questions. We didn't see many in the chat, but feel free to chime in now. And if there are no questions, we encourage you to stay in touch with Christina and I, and we would welcome any follow-up questions that you might have. And Kathy can also send our contact information in the follow-up. So thank you so much for being part of the conversation today. We really appreciate you taking the time to learn about mental health and the data that really informs our policy solutions and where we've come from when we were in a state of emergency of youth mental health in 2021 to where we are right now. So thank you so much.
Thank you, Christina and Alexis. This was very, very informative and what an eye-opener. And we appreciate all the information that you have provided. And thank you for sharing your knowledge with us. And please, any of the participants, if you have any questions for us, then they'll stay on for a little bit. And I will put the evaluation in the chat, but you will receive it also in the follow-up email that I will send to you along with the copy of the slides. And again, you will find the recording of this on our YouTube channel. So thank you again for coming today, and thank you again to Alexis and Christina.
Is there data available around how basic needs access is impacting the demand for mental health supports? Thank you for that question, Alex. Yes, I think that there is data available, and we're happy to take a look at some of that for you, Alex. If you wanted to reach out to us afterwards. Um, there are a few places where I go, and I know one really solid place for Colorado specific data is the Colorado Health Institute's annual health access survey that they put out, and they're releasing their most recent data in the next month, actually. So I would check out, and they're having a in-person and virtual event where they're going to go through all of the data. And I'm signed up for it. So I definitely think that would be a great place to go to. I think as we are considering what's also happening right now with the government shutdown and the fact that folks are going to be cut off from their SNAP benefits next week. We know there are adult and child caregivers who aren't going to be able to access the child and adult food program as of next week. Folks are experiencing loss of Head Start payments starting next week. All of these things, right, are going to impact people's mental health. I think that's that public health approach to mental health is understanding that basic needs have to be met, or else it causes stress, it causes trauma, and it doesn't allow somebody to also support their mental health and overall health, really. So I think it's really important, but I would definitely check out the CHI data that's coming out very shortly. Alexis, do you want to talk about this next one? How are language barriers being addressed when trying to access mental health?
So I think one of the main barriers to access when it comes to language and accessing mental health services is the number of providers that are bilingual and able to provide treatments in the language of people's culture and their hearts. And so part of that really stems from the pipeline of the workforce. And so I think part of it is being able to add languages and or classes in multiple languages so people can meet the requirements to become licensed to be able to provide these services. And that requires investments in our education system here in Colorado, as well as like the nation. And another thing we can look at is the possibility of being able to credential people that have met the requirements in other countries. So they're able to come here and provide mental health services in the language that they already know. And I think that in part, this is something that the Behavioral Health Administration is really working on in their workforce development work. Yeah.
Thanks for that. That's great, Alexis. And this looks like a question that's perfect for you to answer, Alexis. Alexis led our work on social media and AI and its impacts on youth. So Alex said, I'm wondering if you know of a good place to look further into the impact of AI or social media on youth. The 2023 HKCS isn't super relevant anymore, and I'm not sure what that is.
The Healthy Kids Colorado Survey. I got a lot of my great information from the Surgeon General's report, which was released in 2024. And so I think that that has a lot of the most recent data. And then also there is a Children and Screens, which is a California-based organization that keeps really up-to-date information about the impacts of social media and AI on youth mental health. And they have information about all ages, early childhood, and teen mental health at Children and Screens. Let's see.
I'm happy to read this question out. When considering the shortage of mental health professionals, is there a consideration of the systemic issues that make it difficult for mental health professionals to provide care or even continue in the profession? I believe we are now seeing an exodus of mental health professionals from the field. or we are seeing a move away from accepting insurance due to the difficulties insurance makes for mental health professionals. The latter also impacts accessibility because few people can afford self-pay. In addition, insurances, including Colorado Medicaid, are making it more costly for solo practitioners and small practices to justify taking them as forms of payment due to the complexity of administrative tasks. Alexis, I think you're also should be able to answer this question based on your bill 1002 last year, as well as some of the work that's going on this year. You're on mute.
Yes. So last year, Healthier Colorado helped pass a bill, House Bill 1002, which really established standard definitions of medical necessity across all insurers. And we've seen that a huge reason that providers are leaving Medicaid, leaving insurance networks in general, is that they are spending so much of their time fighting with insurance companies and like still having mental health claims denied. So part of it is making sure that insurance actually covers the mental health benefits that they promise in your benefits. We're hoping that implementation of this bill, House Bill 25-1002, will help address this issue. It goes into effect January 1st of this upcoming year. And that's not a solution necessarily for right now, but we're hoping that it ensures that providers are able to get reimbursed from insurers for medically necessary mental health services that they're providing.
I think to your point around having it be challenging for sole providers or small businesses to exist, given the payments structure that we currently have, is a point that's well taken. And we are seeing more and more practices, not only in mental health, but also in primary care, which is another area where, primary care is also a really challenging business model to maintain, that they're being bought out by either private equity or large hospital systems, which can be helpful to maintaining access in certain parts of the state, or keeping people's doors open, but of course can also add more challenges such as affordability. Like if somebody is bought by a large hospital and the hospital charges facility fees to people who come to their clinic, that's fees that are charged to consumers over and above their copays, and they may not even realize that they're going to get charged that bill, which makes the access potentially not accessible anymore if it's unaffordable for them. And then private equity in and of itself seems to be driving up the cost of healthcare overall. So I do think that those are points that are well taken, and I think it's something that Alexis and I are talking about a lot through our advocacy. And I think it's important for any of you on this call who are able to advocate and educate our Medicaid agency and other, our Department of Insurance, or even just the public about how these things are challenging. I think it's important for them to hear it. But of course, our state is entering into a period of really challenging budget conversations because we're in a deficit. And so I don't see there being a world where we don't see additional Medicaid cuts. And that's really unfortunate given how important healthcare access is as well. Thanks for these great questions. Very thoughtful. Sorry, we don't have the perfect answer, Jennifer. Happy to take additional questions if there are any, or send additional resources afterwards.
Well, thank you again. The questions have been wonderful. And I will send all the resources that Alexis and Christina have shared. I will send those in the follow-up as well.
Thank you again for everyone that came and was part of this conversation today. Feel free to stay in touch. Christina and my emails are in the chat and will also be part of the follow-up.
I'd also like to thank our interpreters.
Thank you.
Always amazing.
Yes, thank you. Thank you everyone for being here. Please make sure and you follow up with that evaluation.
And contact any one of us if you have any questions. Thank you and have a wonderful rest of your day.